Okay, good morning. I'm Commissioner Ed Rothstein. It's January 4th. We're about ready to start an open session. It's a relatively short notice open session with regards to the impact our governor has shared with us over the last few days during his press conferences. We'll gavel in just a couple minutes. We're waiting on one to come on board. I apologize for the delay, but just give us a couple of minutes and we will start no later than 9:55 or 10:55. Thanks. Okay, once again, it's Commissioner Ed Rothstein. Apologize for the delay. As always, let us start with the Pledge of Allegiance and a moment of silence, and then we'll get right into the meat of the discussion for this morning. Thanks. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, as I shared a couple minutes ago, I appreciate my colleagues and team, especially Chris, who is managing most of this, to get us on a very short notice open session. The intent of this open session is to share the highlights from what our governor has done over the last few days with his recent press release, and then this morning at 10 o'clock with his press release and proclamations. There's also some things to unpack from this past Thursday in moving forward. I really, again, appreciate our healthcare, hospital and Carroll County Health Department for all they are doing. You know, the numbers are still amazingly staggering in our hospital system at Carroll Hospital, with 191 patients there, 15 in a critical care unit, all 15 having COVID-19, 12 on vents, and 73 COVID plus patients in the hospital right now. Also, to break that down, out of that 73, 75% are unvaccinated with an average age of 58 years old in the hospital. 19 or 26% are vaccinated with an average age of 78. Just let that sink in for a second. The governor shared that there are 3,057 as of this morning that are COVID positive hospitalizations. That is an increase of 500% over the last 7 weeks. He has allocated now $100 million of state funds to the hospitals and nursing homes in moving forward. All nursing homes with outbreaks will have mandatory treatment available from state agencies. He expects things to change, and now this is our governor talking from the information that he has been provided. Things could change over the next 4 to 6 weeks, but this will be the most challenging times. He expects, again, when I say he, our governor was speaking, but let's take it for what the state is saying, more than 5,000 COVID positive patients in our hospitals. He has now declared, as effective this morning, a 30-day state of emergency, which really does two focused areas. One is focused on the hospitals, where the Maryland Department of Health will regulate our hospitals across the state. They'll also provide allowances for interstate reciprocity for nursing and healthcare, along with providing allowances for retirees and graduate students of nursing and healthcare to be put into the system. He is also looking at augmenting our emergency services workforce by activating 1,000 National Guard. In addition, 250 of those National Guard will be supporting our testing sites. There are 2 state testing sites right now, one up in Bel Air and one in Anne Arundel County. They are now putting in place 20 additional testing sites that will be opening soon. And I'm sure our health department is on the ground working with the state to figure out where exactly those testing sites will be from the state, in addition to the testing sites that we are providing and putting in place at the Ag Center and everything the health department is doing. The governor shared that the best fix to this challenge is to get vaccinated. He is highly encouraging all, as we all are, to get vaccinated, or at least I am from this position, to wear the mask, to avoid crowds, and to keep ourselves, wash our hands and use common sense. 92% of Marylanders, adults, he said, are vaccinated or have begun the vaccination. 33% of our children, and I didn't catch if that was 12 to 18, are vaccinated. He is requesting this morning for the President Biden administration for federal support of monoclonal, support, along with those pills that, and I don't know the details, but basically preventative medications that are held at the federal level. He is requesting for federal support of that. The other piece of this is from his press release the other day. He is requesting that all state facilities will require face covering. He is authorizing at the state level paid leave for booster shots to be provided. He is also providing at the state level updated quarantine protocols for all state employees that are within CDC guidance. Thanks, Chris. And those are the three that I just mentioned: the state buildings, the paid leave for booster shots, and the updated quarantine for state employees. Additional actions with COVID-19, Chris, I don't know if you have the next slide or another slide, is establishing surge operation centers, committed to the additional $100 million that I shared, begin to distribute the 500,000 at-home rapid test kits through our Carroll County Health Department and the local health departments, expand the days and hours of state-run testing facilities, making an additional $30 million in funding available to school systems to further enhance their own testing resources, and to expand the genomic sequencing to track and detect COVID-19 variants. The other thing he highlighted this morning was the importance of keeping our schools open and doing everything that he can. Again, I use the word he as the governor was speaking, but take it for him with his leadership and administration to keeping our schools open. And everything he shared, just as we did on Thursday, the importance of getting vaccinated, wearing the masks, and avoid crowds. The information we provided on Thursday was, as I shared later on, to provide safety for our employees, to keep ourselves by leading by example because of our authorities that we have not being able to go into the businesses, nor should we, because we have, shared this often. We do not want to mandate our community into doing something. It's not our place to overstep our bounds. But what we can do is work within our local government, our county government, and lead by example and encourage everyone to get vaccinated, as that has been the proven, way of minimizing the impact of COVID-19. And then the third is readiness. And this is a very important, again, it may be the military coming out in me, but everything we do, I believe in readiness. We had a very small snow falling the other day. We need to ensure that the plows can run. We need to ensure the drivers can drive those plows. So it's all about readiness. We have 1,000, plus workforce for Carroll County government. It's not just by protecting them just for their own sake, but it's to ensure that they have the ability to serve you for safety, security, and quality of life. and quality of life for you in Carroll County is ensuring that you can get out of the driveway, you can do the things you want to do, you can get your kids to schools, you can go to the stores, to the shopping centers, wherever you want to go and move around. That's all part of our quality of life. In order to do that, we need to be ready. In order to be ready, we decided on Thursday to put the decisions in place by masking those that are unvaccinated in government buildings. Those that are vaccinated have the option of either being masked or not masked, and to continue to encourage vaccines for all of our government employees. Now, that's what we put in place effective 1 January. I'm going to open up for discussion amongst my colleagues. And, you know, I have here two different masks, the cloth mask and the KN95 mask. This is the standard mask that, you know, is being requested to be used in our county facilities currently for those that are unvaccinated. Now, again, that may change through our conversation that we have. But last recap, there is a state of emergency that has been put in place by our governor. The focus is on our healthcare and our EMS. So with that, does anybody have, or who would like to lead us off after that?
Don't everybody jump at the same time. Good morning, and here we are again. And I truly do think, as the governor and a lot of the experts are saying, that we're in a 4 to 6 week period here where we've got to, again, be very mindful of what we're doing. Let's be honest, and I'm included in this. I believe we all became quite complacent as the numbers started to go down, and now we've got to get back to making sure that we protect one another. I want to thank those in our workforce, first of all, that for whatever reason that they have, and I'm not going to get in that debate because their rights are just as important as mine. But for those that respected the fact that we were trying to protect our fellow workforce, and for those that were not vaccinated, covered up. And I want to thank those that did that. I want to be clear, we didn't mandate that. We asked that to occur. I also want to say that we added to that everybody should be masked in the common areas, just as a matter of respect for one another until we get through this surge. And I think, again, it's going to be sounds to me like it's going to be about 4 to 6 weeks. Hopefully by the 1st of March, we're back to some sort of normalcy here. So I think I want to applaud the governor. You all heard me say this when I was the president of this group, and we were in the heat of battle. We've always followed his guidelines, his team's guidelines, as we get through this. And I think, again, that's what we need to do. I believe we need to make sure that everyone is masked up in the building, regardless of your status. That is what it is. But I think everybody should be masked up at this point. Obviously, and use some common sense here. If you're in your own cubicle or in your own office, let's be clear. You don't have to, if you're by yourself. But if you're in meetings or in the common areas or whatever, I believe all county buildings, until we're through this surge, we should be masked, and just leave it at that. And again, I want to thank everybody that has continued to function here. We dodged a bullet yesterday. I was thankful to see that finally the Eastern Shore got snow. They always joke about us, and flowers are always blooming, the sun's always shining on the other side of the bridge. Well, guess what? That 6 to 10 inches that they've got down there, doubt if the flowers are blooming. But anyway, we dodged a bullet and didn't have to engage much here. I know in the southern part we had some ice or whatever. But as Commissioner Rothstein says, we've got to make sure that our workforce continues to be ready. And, if we get another snow here, when you hear about the fact that you get a lot of folks that are not able to function in their job because they're being quarantined or whatever, this, I think, the masking policy goes a long way in hoping or helping and assisting where that won't occur, and we can keep our workforce healthy. And again, look, the masks are what they are. I know everybody's getting tired of it, but I think for these next 4 to 6 weeks, that's what we need to do. And hey, for no other reason, I had 16 degrees at my house this morning. When you have a mask on, it keeps your face warm. Just saying. Anyway, I don't want to make light of this, but I do believe that that's what we need to do, taking these next steps forward, and certainly follow the rest of the guidelines. But I think that's the most critical part here in our government building. So I'll stop there.
Commissioner Frazier.
Okay. I have to agree with Commissioner Wance. I think all throughout this pandemic, we have followed the state's guidelines and followed what they've done. They have requested that everyone in the state buildings wear a mask. I think we should request that everyone in the county buildings wear a mask. Everyone, regardless of vaccination status. I just think it's at this point the right thing to do, because it's the virus is getting out of control. We don't have, the best tool, of course, is vaccination, but mask help, washing hands, social distance, all that helps mitigate it. So let's do everything we can to mitigate this and keep our workforce ready to go, as was the two previous commissioners have mentioned. So my suggestion is that we follow the state guidelines on this. All county buildings, everyone's masked when you're inside the building.
I agree with you guys. It's what we started originally. We're going to follow the governor's guidelines, whether you agree with them or not. He's looking out for everybody in the state. We need to look out for everybody in the county as much as possible. So we follow those guidelines, at least for the next 30 days, and just move ahead. Try to keep everybody safe. Try to keep the people out of the hospital. I don't think we're doing anything unreasonable. We're just looking out for safety of everybody in the county.
The state of emergency put out today were focused on healthcare and EMS. His guidelines, so that was the focus of the state of emergency. The guidelines that he put out the other day, not underneath this state of emergency, but as he directed, was the face covering in the state buildings, the paid leave for booster shots, and the updated quarantine protocols for state employees. So I guess my question is it the intent for us to take the word state out and put county in, face covering requirements for all county buildings, provide paid leave for booster shots for our county employees, and updated quarantine protocols for our county employees? Is that?
Well, just to jump in, the 2 hours that he's given, I think it's 2 hours he's given off for the booster shots, also mentioned that if you haven't been vaccinated, you can use that time to take the 2 hours to be vaccinated as well. So it's not just boosters, it's to get the first or second shot of the vaccine and or boosters, whatever you happen to need at that time, 2 hours off. So I just want to interject that in there. And yes, if you're asking me, yes, just put county in there instead of state, and we can move forward with that.
Okay.
That makes sense.
Okay. So is that a motion?
I'll make the motion that we follow the state guidelines.
I'll second it.
Okay, I got a motion. I got a second. Is there any further discussion on this? Seeing, hearing none, all in favor? Aye. I apologize too. Thank you. Okay, against? 4-1. Okay, let's move on. Let's see. Is there anything else to move on to for this morning? State of the county. We need to decide. Talking to Mike McMullen, President of Chamber of Commerce. Our State of the County is scheduled for next week, I think on the 11th in the morning. There are options of what can be done. We can do what we did last year, where we conducted the State of the County in the Reagan Room, and having those that sponsor get in front of us and make their comments, and then push it out appropriately through the magic of Chris Swam and Television Land. Another option that was thrown out there was to postpone and push it to the right to see where this state of emergency goes and all the activities go surrounding the virus. There's concerns for both. One is, the less interaction with the first option, and the second challenge for the second option is the expectation to kicking off the new year with the state of the county has been something that Mike has said, this is a good thing. Plus there's other conflicts if we push it to the right on his calendar. And then we'll also be going into our budget season and deliberation. So those are two options. If there's a third, throw it out there, but I think it's something that we should discuss, and the importance of this is to make sure that, Chris and the others and Mike, and he can get out to the county Chamber of Commerce. So any thoughts? No thoughts?
Well, I've got some, but here's, I know everybody's shocked face. I have thoughts. Anyway, I was in favor of, or I talked about getting it postponed. And I believe when I had that discussion with the president of the chamber, the first Tuesday of February was available because that is typically their government day. And obviously they're not going to be able to do that because the government buildings in Annapolis are not able to take visitors or on a limited basis. So the typical thing they usually do won't happen. The interaction, and I'd like to see where we are in 4 weeks and see if we can do it. And then if not, then we'll go virtual with it. But I'd like to wait. That's me. That's what I'm thinking. And maybe a little bit of selfishness here. This is my last state of the county. I'd sort of like to be in front of folks instead of the camera. So if they can work it out, and Mike thought maybe they could, I'd just like to postpone it until that first Tuesday of February.
If that is a motion, I will second it.
I think we can make a motion, Eric, on that. I think that's just a recommendation for Mike and his folks to see if he can work it out. I think right now it's maybe in the suggestion mode, but I don't know. That's just you and me. There's 3 other ones. So I don't know. Dick, Dennis, whatever. What are you thinking?
That makes sense. I mean, just simply push it down the road a little bit, see how things fare out. And if not, we'll just go virtual.
Okay.
I do like the idea of doing a state of county in front of people. I think it's just much better that way, much better interaction. I feel the energy. So I like the idea of pushing it back a little bit, but if you push it back to that Tuesday, then it doesn't go beyond that. If we can't do it, then it's that day and it's virtual.
Okay.
I don't want to go on forever with it.
Sounds good. We'll pass that on to Mike and the chamber, and I think it gives them enough lead time. What else needs to be discussed this morning?
How about our future sessions here for the next
You're
couple
right.
weeks? I don't know that it's a good idea to be, even though we've got the barriers and stuff, I don't know that's such a good idea. I think until we get through this surge, maybe at least the month of January, let's say, and monitor it. If we see things changing, then we can flip back to in person. But at least for the next, maybe we should go session to session just to see how we're doing. But I think that would probably make more sense instead of just a blanket statement or virtual till whenever.
Well,
Maybe
we put the 30 days in
understand.
place.
What would you say?
We put the 30 days in place. for
Well, we
mask-
did. I mean, we could say 30 days, but we could always change that too. I mean, our staff's really good at making decisions on the fly. So at least for this Thursday, I think we should stay virtual. Keeps everybody in place, keeps folks out of the common areas, with the masking thing and what have you. This Thursday and maybe next Thursday or whatever, switch to virtual.
Wait, I apologize. Say that one more time, Steve. What do you,
At least this Thursday, I'd kind of like to go session to session and instead of a blanket statement, but at least this Thursday, I think we need to go virtual with our session on Thursday. And then we'll see where we are and go week to week.
okay, any comments on this?
I'm just agreeing with Commissioner Wance once again.
Okay, any comments? Okay, so we'll go virtual, schedule go virtual on Thursday. Okay. Recapping. Typical, well, no, I won't say typical. The states of emergency that we have put in place have been,
Hey, Ed,
Following
before you read, hey, Ed,
what?
I think Roberta had her hand up or something.
Go ahead, Roberta.
She was either jumping up and down or had her hand up.
Go ahead,
I'm not sure.
Roberta.
Just a couple details. So the board wants to award staff 2 hours of administrative leave to get boosted or vaccinated, correct?
Correct.
Do you want to make it retroactive to folks who have already done so?
No, I think we need to move forward with what the governor said. His actions, exactly the way they're written.
I think his were retroactive if you put it back up. again.
Were they? I apologize if they were. That's kind of where I was going to go with this next comment was, the state of emergency that the governor put in place had to do with healthcare and EMS. And, what we are doing is not taking that state of emergency. We're taking actions from what he's directed the other day. So
Yeah.
we can call it a state of emergency for Carroll County with these three actions. You can call it whatever we want, but
Well, I didn't hear the board actually declare a state of emergency.
right. And I don't know if there needs to be.
No, not to do what you've done so far.
Right. And I don't think, unless there's needs to be a state of emergency put in place, I think what we can do is exactly what we said by the vote of 4-1, that we're putting these three actions in place effective now.
Okay, so it does have a retro, as you see, and that's halfway through. The benefit will apply retroactively for employees who present proof of receiving a booster. They'll receive retroactive leave.
So for me, I don't care. I don't care what it says. I absolutely think it should be retroactive.
Okay, well, it says retroactive. So,
Okay, well then I'm in complete agreement that we should provide that opportunity for those that have already done so, and for those that now hopefully will be influenced to do so.
Is that for just booster shots or booster or vaccination? Just want to be clear.
Booster or vaccinations, as far as I'm concerned. That's just me.
Yeah, both.
Okay, Commissioner Weaver, both. Rothstein.
yeah, we're good.
Okay, and I don't know if you want to. Okay, thank you, Commissioner Boucher. And then we've already gone to the updated quarantine protocols for pursuant to CDC and what the CDC did on Monday. And so that's not a question. With regard, the only other question I have detail on is the board is going to be virtual, at least for the next week or so. What do you want to do with boards and commissions? Do you want to make those virtual?
Yes,
If they
I
can
would say-
conduct, I mean, if
I would
business can be conducted in mask, they can be conducted in mask. It doesn't seem like having boards and commissions, conducted in masks makes a whole lot of sense. Then we should be going virtual. And that's kind of where we're at. So it's not a week to week. We're putting this in place, for the next 30 days, whatever it is. Then let's just say we're going to go virtual. I mean, if not, I think we're going to have a challenge with this. Okay, what about this week or next week? Let's just say for January, we're going virtual for all boards and commissions.
I think that's a very good point. Plus, this Thursday, we have the joint BOE meeting, so we'll have to set that up as virtual as well.
yeah, I agree, Eric. Yeah, spot on. Yeah, look at that. I'm agreeing with you. I think that's just, in order to make the staff lives easier, let's just say for the next 30 days, everything will be virtual. I agree with that, Ed and Eric.
Okay, so Board of Commissioner meetings, Liquor Board, Board of Zoning Appeals, Planning Commission, all virtual.
Say
For 30
everything for 30 days.
Okay, just to keep it simple. Thank you. That helps. Okay, thank you, gentlemen.
Okay, what else needs to be discussed? Okay, I think we have clear direction on how we're going. Again, I do get, just to let you know, updates from the hospital and health department on the numbers. And, our focus is whatever we can do. And that was the focus on Thursday, was whatever we can do to support the hospital, our health department, our EMS in resourcing and getting communications out. That's our responsibility, in my view. And let's just continue to keep pushing that, because they're the front line that's doing a whole heck of a lot of work. And some of these updates are just, they're dire, from our EMS and from the hospital. So.
One last thing, Commissioner Rothstein, thanks for recognizing the hard work of our EMS staff and the hospitals. Do we have any numbers on the fatalities? How successful have we been, or everyone been in the county, at saving lives?
Once again, I don't know, and this has nothing to do with fatalities. I'm giving numbers from the hospital. So that's all I'm giving. If you want to reach out, you can find out, but that's all I know.
You're telling me that you get all this data from our hospital and they didn't include any fatality rates?
No. Anything
I
else?
find that quite puzzling, because ultimately what we're all trying to do is save people's lives. Are they withholding that information from us?
Commissioner, if you want to ask, you can ask. I don't know. I'm giving you
Yeah.
the numbers that are provided by the hospital. I don't believe that the hospital or our health department or Maryland is withholding anything, but that's just my view. I'm giving the numbers, and we'll just leave it at that. I can't go beyond that. I'm not going to speculate. I'm not going to assume.
We were tracking the fatality rate very closely for a year and a half, and now you're saying we're not paying attention to the fatality rate? I
I'm
find that
saying the numbers that I'm given from the hospital. That's it. That's
So-
facts.
so
I'm
the
not,
hospitals
hey,
intentionally
I'm not
withhold
speculating,
fatality rate from
and
us.
I'm not assuming. I'm given numbers that were given to me. That's it. I can't go beyond that. I have no data. I have no ability. I'm not a doctor. I'm not in the hospital. I'm given the numbers that are given to me. If you want further data, you can request further data from the hospital or our health department or the state. I don't know. And I'm
I
just-
have to say that is quite irresponsible of us as a board not to put this information out in front of the public. And the fact that the hospital did not release that information to us says they're covering something up. Because our ultimate objective as publicly elected officials is to save lives. And the best gauge we have is to determine whether we're saving lives or not.
Okay, once again,
Listen,
I'm not going
let me-
to talk about the hospital being lying to us or unethical or anything they're doing. I'm just saying these are the numbers that are given to me, and that's it. And I'm passing on these numbers because I believe they're relevant in the discussion. Just as I shared with you what our governor said with the numbers that are in hospitalizations currently. That's all the information I have. To get further information, you can request further information. I don't have it. That's all I'm saying.
Listen,
We-
I'm sure.
Whoever's out there in the hospital staff or the leadership should get that data to us and get it out to the public, because it is the best gauge to determine whether we're successful or not, and that is our ultimate objective, to save lives.
Sure they're tracking that. I'm sure they're tracking it. I think right now, because of last minute stuff, they just gave us the numbers that we asked for, and we didn't ask for that specifically. So they always tracked it, and I'm sure they have that. That
I
should
didn't
be.
ask for any of this information. I didn't ask.
They just gave us what we typically ask for as an ongoing issue here. So, but I'm sure they've got that. We can ask them.
Okay, any other discussion?
The only thing, once again, for me, Ed, is just to strongly encourage the citizens. I know we've got quite a bit listening today. Just encourage common sense, best practices as we move forward. I don't think it's necessary to stop your lives here again, like we did at one point. But I think if we utilize best practices, if we continue to say, gosh, facts over opinions, say that masking and vaccinations are effective, that we can get through this next 4 to 6 weeks. And, just strongly ask our citizens to work with one another, respect one another, and we should be able to get through this.
I just want to say, Steve, I agree with you. I've been to many of the businesses we have out here are individually, some requiring masks, some not, but I think you need to respect each business owner and what they ask of the general public coming into their establishments. The last thing we want to do is put things in a tailspin like we had a year or so ago. We need to keep businesses open. We need to keep kids engaged as much as possible. To do that, we just ask everybody to, hey, I know it's a pain, wear a mask, get vaccinated if you can, and keep moving forward. I would like to see the end of this by 2022, or at least a downtick to it, that we're not going through this for a third year. This is, it's getting old, it's wearing on everybody. I think tempers are getting short in some aspects, but we have to stay the course, get through this, get ahead of it, and this will be hopefully in a couple years a memory.
Again, this is about the overwhelming hospitalizations. There's 3,057 that are in hospitals in Maryland right now, a 500% increase in the last 7 weeks. The expectation is that there will be over 5,000 hospitalizations. Our hospitals are overwhelmed. Our healthcare system is overwhelmed. Our EMS is overwhelmed. The state of emergency put in place by Maryland, by our governor, is to help this situation of the hospitals and EMS being overwhelmed. That's what this is about. So the numbers that were given are given. I'm not asking for additional information. We can, but it's about hospitalizations in our healthcare system. And I once again, personally want to end on a note of thanking them for all the work that they're doing and being so short-staffed, all the work that everyone is trying to do in keeping people out of hospitals. Get vaccinated is the most encouraging thing that could be said. And that is keeping people out of hospitals. So that's my last words. Anything else? I need a motion to
I move we adjourn.
a motion to adjourn. Do I have a second?
Yeah, I'll second that.
Okay,
Aye,
all
I'll
in
second.
favor?
Aye.
We're adjourned.